The head of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, has called on leaders to bring desperately needed peace to the world and health and, of course, safety to all, reiterating that peace is and will always be the best medicine for the health and well-being of all the people everywhere around the world. Now let's have more details of that in this report by Mamadi Barrow.
World Health Organization (WHO) continues to work worldwide to promote health, keep the world safe, and serve the vulnerable. The organization's primary goal is to ensure that 1 billion more people have universal health coverage and to protect 1 billion more people from health emergencies and provide for 1 billion people with better health and well-being. The organization has played a leading role in several public achievements, most notably the eradication of smallpox, the near eradication of polio, and the development of an Ebola vaccine. Its current priorities include non-communicable diseases such as HIV/AIDS, Ebola, malaria, and tuberculosis, non-communicable diseases such as heart disease and cancer, health, diet, nutrition, and food security, occupational health, and substance abuse. At global policy level, the Global Health and Peace Initiative is also WHO's contribution to the United Nations Sustaining Peace Resolutions, which requests all parties of the UN family and the World Bank to use their influence for mediation, conflict prevention, and conflict resolution. It also furthers the humanitarian development peace nexus by reinforcing the key role of health as a driver of peace and sustainable development. In addition, with the emphasis on community ownership and empowerment, the initiative reinforces WHO's commitment to an implementation of localization. In an end-of-year video message, the director of World Health Organization, Tedros Adhanom Ghebreyesus, called on leaders to bring desperately needed peace to the world. The WHO boss recalled that during Christmas week, he was in Yemen on a United Nations mission to negotiate with the country's de facto authorities for the release of detained UN staff and other humanitarians.
During Christmas week, I was in Yemen on a United Nations mission to negotiate with the country's de facto authorities for the release of detained UN staff and other humanitarians. The talks with the Houthis proceeded positively, and we hope they will bear fruit. While waiting to board our flight in Sana'a, the airport came under aerial bombardment by Israel. The attack inflicted needless death, injury, panic, chaos, and damage, and was another reminder of the growing threat faced by civilians, humanitarians, and health workers in war zones around the world. This must stop. With a new year upon us, our leaders must bring desperately needed peace to the world and health and safety to all. Peace and health are linked. From Gaza to Sudan, Yemen to Ukraine, and Haiti and beyond, peace is and will always be the best medicine for the health and well-being of all people everywhere. For the World Health Organization, health for all is our guiding light. We pursue this mission often by working in dangerous places. We do this to protect and promote people's health. We go the extra mile.
Tedros also listed some of WHO's achievements of the past year that include eliminating malaria and other neglected diseases in numerous countries and opening the game-changing WHO Academy in Lyon with French President Emmanuel Macron.
Some achievements of the past year include eliminating malaria and other neglected diseases in numerous countries, 17 countries from Africa using a new malaria vaccine, making a new vaccine against dengue, celebrating 154 million lives saved thanks to the expanded program of immunization founded 50 years ago, making the world safer from outbreaks and pandemics by strengthening the international health regulations, certifying the first mpox vaccines and tests, reducing tobacco use globally, and opening the game-changing WHO Academy in Lyon with French President Emmanuel Macron. But bolstering global health security to protect against future outbreaks will require more work in 2025. These actions and more will help make our families, communities, and whole world healthier and safer. To succeed in this vital quest, we must invest in essential measures to promote and protect health.
WHO's work in linking health and peace also contributes to advancing the Sustainable Development Goals in an integrated manner and the 2023 UN Secretary General's new agenda for peace, which makes a renewed call to implement the Sustainable Development Goals. SDG number 3 on health and well-being recognizes that risks to health and well-being, especially maternal and child health, are significantly aggravated in settings affected by conflict and other forms of organized violence. Conflict and violence also have significant negative effects on mental health. Reporting for Eyeafrica News, I am Mama.